If you are one of the many millions of people who take antidepressants, chances are the clinician who prescribed it for you probably didn't have a huge amount of time to run through things like how effective it might be for you, what the side effects are, and really importantly, how, when and why you should try and wean off the antidepressants. So watch this video all the way through for loads of information I think you'll find really useful, and do share with anyone else who also might find it helpful. Actually, antidepressants aren't only just used for depression, they're also used for anxiety, OCD, which is obsessive compulsive disorder, PTSD, which is post-traumatic stress disorder, and also pain. And we're not quite sure how they work. We think it's probably to do with the fact that they increase certain neurotransmitters in the brain, such as serotonin and noradrenaline, which are linked with mood, emotion, and pain sensors. And in terms of evidence, there's not brilliant evidence that they work very well for anyone with mild depression. So if you've got mild depression, chances are you're better off thinking about things like therapy and getting more exercise and eating well and doing things like that. Because actually there's quite a lot of downsides to antidepressants. So if you've got mild depression, the evidence base is probably a little bit more on the balance of risks rather than benefits. But they can be helpful if you've got moderate or severe depression. And they can help lift your mood a little bit and also give you that extra motivation you need to get on with doing things that can help sort your life out and focus on therapy. Because we know that evidence shows for people who are on antidepressants, they will do even better if they're also having therapy at the same time. So once you start antidepressants, it's really important that you do try and take it every single day. Don't miss a dose, because we need that for it to work. And actually by missing one dose, you can actually get withdrawal effects. So sometimes it's 1 tablet, can be up to 3 tablets. It depends which antidepressant you're put on. In the UK, we often use ones like citalopram and sertraline and mirtazapine. In the US, it's often named after the brand name, so like Prozac, which we call fluoxetine. And it can take at least 1 to 2 weeks before it even works at all, so you've got to be a little bit patient with it. And then we suggest that you need to be on it for about 6 months after you feel better. So how long's a piece of string? Obviously that's going to be different for everyone, but it's a good guide to think about when to plan to come off. Okay, so if antidepressants are useful, which they definitely are for a lot of people, then why can't you just stay on them forever? Well, some people are on them long term, some people are on them maybe forever, but like any medication, they do come with side effects, so it is a good idea to try and come off them when it's appropriate. And antidepressant side effects can really be significant. You can have physical side effects, you can have nausea, vomiting, you can have headaches and dizziness, you can have sexual dysfunction. So a lot of patients find this, they find they've got a low libido, they can't orgasm through masturbation or sex, get weight gain a lot of the time, and that possibly is what leads to an increased risk of type 2 diabetes. And for some people, especially if they're on multiple different types of antidepressants, they can be at increased risk of something called serotonin syndrome. Now this is rare, but it is potentially very serious, so it's a good one to know about. Symptoms would include things like confusion and sweating, and it can lead to things like even becoming unconscious. Older people, they tend to have even more side effects. So when I'm speaking to anyone who's got depression, who's on antidepressants when they're older, I'm always trying to reduce the dose or trying to get them to come off. Elderly people especially can suffer with low salt within the blood called hyponatremia, and that can be dangerous. So for all these reasons, it's a good idea to try and plan a sensible time for you to come off the antidepressants. Okay, so that's an explanation as why it's a good idea not to stay on antidepressants longer than you need to, but you can't just stop them. So this is the most important thing also to remember, because you will get withdrawal symptoms. Well, actually not everyone gets withdrawal symptoms, but we don't know who might get them and who might not. So we just need to be very careful and work with you on stopping these medications when you are ready. We think about 1/3 to 1/2 of people do suffer with withdrawal symptoms. And for the people who do suffer, about 1 in 4 of those people will suffer with quite significant withdrawal symptoms. These withdrawal symptoms can affect your sleep, they can have physical side effects, and they can have mental side effects. And the kind of difficult thing is a lot of the symptoms of withdrawal overlap with depression. So I'll go on and tell you a little bit more about that. We don't quite know why people get withdrawal symptoms, but we think it's because the brain gets used to the different levels of the neurotransmitters. And so when that's taken away, the brain has to just readjust to this, and it can take a really long time. It can take weeks, even months, even if you've only been on it a short term. And if you've been on antidepressants a long time, or you're on a really high dose, the risks of having withdrawal symptoms are greater. And for some people, it can even take years. Okay, so I'm just going to tell you a little bit more about those kind of 3 different types of withdrawal symptoms that you could suffer from. So firstly, physical symptoms. A really interesting physical symptom that people describe that's very different to depression is they say, I get these like zaps in my arms or my legs or my head. It feels like a little electric shock. And that's quite typical of a withdrawal symptom. So that's quite useful to know. If that's happening when you've stopped your medication, then you need to pull back a little bit. Other symptoms include just a sense of being physically unwell, tinnitus, flushing, nausea, headache, lots of physical symptoms. And then we think about how it can affect your sleep. It can make it difficult to get to sleep. It can cause insomnia, so trouble sleeping, and also vivid or quite frightening dreams. And then it can have effects on your kind of mental well-being. So often people will feel their mood is really varying, or they can have like little surges of anxiety. Some people describe this sense that things don't even feel real, or they have difficulty concentrating. So it's a really vast amount of potential withdrawal symptoms. So what we need to do is work with you on a plan to try and avoid that by tapering your dose of your antidepressants nice and slowly. One way to determine whether this is the depression or whether it's the withdrawal is that if it comes on very quickly once you've stopped the tablets, then it is probably withdrawal symptoms, because depression tends to take a lot longer. And if those symptoms go away when you restart, then it was the withdrawal symptoms. But this doesn't mean that you are addicted to the medication. It's not quite the same as like heroin, where you wake up desperate for it in the morning or you do anything to get it. It's just that your body has become accustomed to it. Okay, so how should you actually taper your medication? Well, do speak to the clinician who prescribes these for you and come up with a plan, but you do need to be flexible, because you may need to go backwards and forth depending on how you're getting on with it. So what I would say is, if you've not been on antidepressants too long, then you should be okay to go ahead and reduce your initial dose by 50% or maybe 25%. And then see how you get on for 2 to 4 weeks. And if all's going well, you're not getting any of those withdrawal symptoms, then you can do that again, 50% or 25%, and see how you get on another 2 to 4 weeks. If you find that you are getting some withdrawal symptoms, then go back to the dose you were on before and reduce at a much slower rate. So you might want to reduce your dose by 10%. And then reassess again in 2 to 4 weeks. So it certainly can take time, and it's certainly not something you want to rush. It's important to note that you should try and avoid alternate day dosing. So sometimes when you're trying to reduce the dose, you might think to yourself, well, rather than taking half the dose, I'll just take it on every other day. But actually, this can cause fluctuations with the chemicals and lead to withdrawal symptoms. You're better off having a steady state of just lowering the dose and taking that same dose every day. If you've been on a high dose of antidepressant, especially if you've been out for a long time, then you're not going to be able to jump straight to a 50% or a 25% dose reduction. You're going to have to start small, and it is going to take a long time. So really thinking about even just a 5 or 10% reduction, and then keep reducing that slowly. And it may mean that you end up having to have some liquid antidepressants instead of tablets, because although you can buy your own pill cutter and cut the pills, that's not really recommended. Best to speak to the pharmacist and your clinician to figure out, to get that dosing just right, because when you get down to really small doses, they can still have quite a big impact on the brain. So even a tiny dose, you still may need to slowly reduce that. So I think I've said this, but you can't rush it. You've got to do it slowly. Okay, so that's quite a lot of information in a really short time, but I hope you found it helpful. And I think it's a lot of things that I always want to tell patients, and I struggle in the short time we have to get through everything. I've got another video all about depression, which goes into a lot more detail into how to manage depression, and I really would suggest you watch that, have a look. Lots more helpful information in that. So I think antidepressants can be really useful when they're used for the right people. And for a lot of people, they won't struggle with withdrawal, but some people will, and we don't know who it is. So best to try and make sure you're working with your clinician to stop and taper down the dose appropriately. I hope you found that helpful. Do have a look at my other videos and watch and share. No, I've got to start now. Well, I'll pick you up again soon. You get down. Can we have less scratching in the audience, please? Less scratching. Oh, using your tail as a drum.